Welcome, everyone, to another great episode of Conversations on Purpose. Today, I have a guest speaker with me all the way from, guess where, guys? Liberia, Africa. So please welcome Dr. Jewel.
Thank you.
Welcome, Dr. Jewel, to our wonderful platform here. Thank you so much for
Okay.
taking the time to being here with us. And so let me just give the audience a little background and then you can fill in where I left out. So Dr.
Okay.
Jewel is an OBGYN and she works with a diverse population in Liberia, young women, women of all ages, and they come with lots of challenges. So today, Dr. Jewel is going to share with us some things that we should be thinking about. What are some signs? What are some things that we need to be aware of as women of color and just women in general? So, welcome, Dr. Jewel.
Thank you so much for having me. I'm happy to be here.
I'm happy you're here too. And so, talk to me a little about your background and what is it that you do in Liberia?
Okay, so I'm Jewel. I'm a Liberian, a medical doctor with specialty in obstetrics and gynecology. Currently, I work with a government hospital called Redemption Hospital, and I'm currently the acting head of department of the OBGYN department. So we cater to women, pregnant women, women with their just women, general women health issues as well. So,
Nice. And how long have you been doing this?
okay, so I've been a medical doctor for 7 years and I've been an OBGYN for 3 years now.
Now, do you like that field?
Yes, I do.
Tell me why. Why what appeals it to you about being an OBGYN?
So first, it wasn't really my first choice, but then after I graduated from medical school, and then the very first rotation I had at the time was OBGYN, and I enjoyed it because it's kind of like it's more physical. You get to see results. A pregnant woman will come to hospital, and then at the end, you take her through labor. She delivers, baby goes home healthy, mama healthy, and then that feeling is just so good. So,
Yeah.
after that rotation, I'm like, but then I want to do OBGYN. That's how I drew interest. And my mentor at the time, she was an OBGYN. She really helped me through, and that was how I grew interest. But
Good, nice. So talk to me about, we have a lot of women who listen to our program and they come on to another program that we have called Women on a Mission, and we do seminars and stuff like that, and always want to know how can we help them? What are some resources? What are, what's out there that we just don't know what we don't know? So as you're speaking about women, what are some challenges that you see come through the doors at the hospital that you are, in general?
so, I mean, for Liberia being a resource limited country, there are a lot of challenges, a whole lot. So, take for example, we have high rate of teenage pregnancies. We have, sometimes because of poverty, you have people come with health issues that could be prevented at the time, but because of lack of finances and sometimes ignorance, because we have a high illiterate population. There's sometimes, when they come, they're almost late. There's a whole lot, and then coupled with low funding at the hospital level, so you don't get to actually treat patients as they come because of lack of a whole lot of things. So the challenges just is range from the patient level to the hospital level, even at the level of the community. So there's a lot of challenges.
Yeah. So how do you overcome some of these challenges? What do
So
you do?
I mean, yeah. So I mean, that's a whole lot. And as a doctor or OBGYN, and even as a human, is really sometimes it gets depressing, but we do what we can do. Let's take for example, there's some patients that will come to hospital, sometimes don't even have the first dollar to even purchase a medication. We can do all for everybody, but we try as much as we can. The ones that we can help, we can help. And then secondly, 2 years ago, because of the high teenage pregnancy rate, and you have a lot of young girls dropping out of school because of pregnancy and funding and what have you. So there was this program that was initiated at the hospital level, the government hospital, even though it has gone down, but we thinking if we can try to revamp it. So what it was like the ages of 13 to 19, girls that are in school that drop out of school because of pregnancy, what happened was the government hospital, through the government, they tried to say, okay, we can support you through the pregnancy in terms of medication up to delivery, and even just get a package after delivery and ensure that you're in school while pregnant so that you don't drop out of school. So that program has been going on. It has helped a lot of teenage girls, at least so that they don't drop out of school. So but then because of funding purpose, I mean, it has died down. I mean, the program's all, but we'll see what we can do as we get help from other people and see it, most especially for the teenage girls, so that
Yeah.
we don't have a lot of dropout, because I mean they are the youthful generation, because what happens to them affects the country at large, because
Right.
if you have 10 girls being out of school and at a certain age they don't want to go back to school, what becomes of them? Even the children they are having, what becomes of them as well? So
Yeah. That is a huge, huge issue.
yeah.
And I must say that it's not just your country. I feel like it's happening everywhere,
Thank you.
even right here in the US. You'd be surprised at the number of the rates of dropout in high schools here in the US as well. And so, what I want to maybe direct our attention to is going back to us women. What are some things that you would want to give us as advice to watch out for? What are some things that we should be mindful of as we are, you know, as an OBGYN, right? I don't, I'm going to admit, I don't see my OBGYN as often as I should. Shh, don't tell anybody, right? She's probably watching and she's probably like, yup, Shrina, haven't seen you in like 2 years, right? But what should we know? As women, what should we be doing?
So there are a lot of women health issues, and when it comes to women health, it's really really big. So there are a lot of women health issues, and for my country, I don't know what happens here, but I mean, to get people to go to hospital is just so hard. And then you have a lot of preventable illnesses that people don't watch out for. Sometimes they come to you, it's almost late.
Yeah.
So me being a resource limited country, and I see a patient with stage 3 cervical cancer, which is one of the most preventable cancer.
Okay.
If I see a patient with stage 3 that I cannot do anything about, but that woman who have be, maybe if she had come early, something would have been done and she would have survived. Or like for now, what happens is that because of the high rate of cancer, cervical cancer, I mean, their new program, the government initiated, added the HPV vaccine that was not in the national immunization. So they've added the HPV vaccine to the national immunization for children below the age of 9 years and below.
Okay.
Pre-puberty girls. So that way it helps a whole lot, because we've been having you know and then because, as I said, I don't know it, I think it's the lack of awareness and the high rate of literacy and the myth that comes with health. There are certain things that people don't believe you as a practitioner tell them. We in Africa, there's a lot of myth going around. This don't work, this don't work, this don't work. So people come to the hospital with illnesses that could be prevented, but because they come late and because they are not aware of these signs and symptoms, and you just come and then they just, some we lost them, some if we are able to save them, we save them.
Yeah, yeah. So what I heard you say is we need to make these appointments regardless, right? At the
Thank you.
first sign,
Thank you.
just go. And even if
Yes.
you're not sure, so I'm going to give you a quick story, right? I'm sitting in my room and I look at my ankle and it looks swollen. I immediately picked up the phone and I text another sister who's a nurse. My ankle is swollen. I'm sending you a picture right now, right? And she's like, "Oh, okay. Make sure you," and she started immediately. But a lot of women aren't like that. They're like, "Oh, that's nothing." Like you said, the myths. "Oh, it must have been something I ate. Oh, I walked a lot today," or whatever that is. So we brush it off and then it's too late.
Thank
And so you're seeing a lot of that happen.
My distant relative of mine had the same issue. She just called me one day like, "Oh, auntie, I have this swollen feet." I mean, she's just in her 20s, swollen feet. So I'm like, swollen feet? I'll think about liver, kidney, anemia. I mean, the whole lot as a doctor coming through my mind.
Right.
So I said, but then let's go and get checked. And lo and behold, she was just severely anemic, walking around with a hemoglobin below 7. So I mean, if she had not noticed that to even call,
Right.
she would even gone into some form of complication, and it make
Yeah.
heart failure or just something that could come about. So,
Yeah.
reaching to the hospital early or just seeking help early, it save a whole lot.
Yes, absolutely. So what else? What else would you tell us to be aware of as women, especially in your field, in the past 3 years that you've noticed that you think a lot of us should be aware of this or no?
Okay, so I mean, we'll go back. So for my area where I work, so sometimes we look at the common illnesses that we see. I mean, there are a lot when it comes to women's health, but we look at the common ones. Okay, so what we do in the morning, we try to pick like every day. We try to pick a topic like the common signs and symptoms. Breast cancer. What are some of the common signs and symptoms of breast cancer that you should look for as a woman? So you don't come with stage 3, stage 4, because a stage 1 breast cancer. I mean, even if there are other interventions that could be done that could save you. So we say, okay, what are some common signs of breast cancer? So we do like a general health talk, and then we allow people to ask questions. So let's say maybe you have lump in the breast, changes in the look of the breast, you have nipple drooling, whatever. You're not pregnant, but you have a nipple drooling, blood or fluid or something. Just those common signs. And the next we talk about cervical cancer. Probably the next we talk about ovarian cancer. Those things. And the next week, like for the pregnant women, we'll also talk about the common signs and symptoms of common illnesses in pregnancy.
Yeah.
High blood pressure in pregnancy, diabetes in pregnancy, a whole lot in pregnancy that we can talk about every day as a health talk normally. But if you don't come to hospital, you wouldn't know.
Yeah.
So, but then again, how do we reach out to those that don't come to hospital?
Yeah.
Because this health talk is just at the level of the hospital that we do every morning. But take, for example, people who don't come to the hospital, how do we reach out to them? So
Yeah.
these are some of the things that we've been thinking about and see how we can reach out to those people that don't come.
Yeah.
Probably they don't come because of certain reasons. It could be maybe lack of transportation. It could be maybe they just don't feel any reason to come. Or just for some other reason. Like if I would have to go to the farm, because we have from where we are literacy rate, like the rural areas, people do a lot of farming. And somebody would say, I cannot spend 5 hours at a hospital. I could be making my farm,
Right.
or I could be doing something else. And sometimes they don't come. We have a lot of home deliveries, and some of them come with complications, a whole lot. So how do we reach out to those
Yeah.
people? That those are some of the things that we're thinking
Yeah.
about.
So you have internal challenges and you have those external challenges,
Yes,
right?
exactly.
Yeah, so it's kind of like, oh my gosh, you're getting from both ends. Like
Yes.
I want you to come in, but then I'm limited with my resources and the funds for the hospital and the manpower. You only have so much staff to do, to maybe do those oh, you know what they do here? I was gonna say like they have the mobile, the drive by where you get in a van and you go to these areas where people aren't gonna come and you park your van there and you say, okay, we're open and everybody can come and
And we
get
don't
free
have
samples of
okay.
something.
We don't have those services back home.
Oh.
So I mean, that will help a whole lot, reaching out to those people that
Yeah.
don't come to hospital for some other reasons.
Right. I've seen them do it here in the US where they have those mobile vans go out to the communities that they would like to reach or just to give education pamphlets, brochures like, hey, what are some signs to look for when you're pregnant and if you're starting to see these signs, this what it might be, right?
Thank you.
And stuff,
Exactly.
yeah, stuff like
I
that.
mean, I mean
Yeah.
that's good. That's good.
Or even after I leave the hospital, what do I do if this happens, right? Because I can't come back because of whatever reason. So, what happens if I'm experiencing this? What if the child is crying and can't stop? Who's there to help? All of those things we need as women or
Yeah.
just families in general, right?
Yes.
Yeah.
Exactly.
Oh my gosh. This is so much. It's amazing that we've evolved a lot as a world,
Yes.
right? Everyone has a phone. Almost everyone, I should take that back.
Yeah.
Almost everyone has a device or access to a device in certain parts of our world. But there's still more work to be done.
Yes. Because from back home where I live, I mean, you have network in the urban area, but certain part of the rural area there's no network, and even the distance from a home to a hospital, maybe if you're walking by foot, would take you sometimes 5 hours, seven
Yeah.
hours,
Yeah.
and some of the places are not accessible by vehicles. So sometimes a pregnant woman gets into labor, she cannot even reach at a hospital. Sometimes either she delivers on the road, or maybe if she happens to get a motorcycle, what we call motorbikes, to get her to the hospital. So sometimes that has been some of the contributions to our high maternal mortality rate, because the delay in reaching at the hospital is a whole lot, because lack of good roads, transportation is so bad.
Yeah. Earlier, you talked about when you get together at the hospital, there's some common things that come about. Has any of them been around postpartum depression?
So we've had yes, we've had, even, I mean, I who here, I suffered postpartum depression as well. So we've had, but what happened is the hospital is structured in a way, we have, I mean, there are different departments. So we have the mental health department. So if we recognize these signs and symptoms, we try to intervene at our level. But there's some of these things are beyond us. So we refer them to the psychiatrists, or we have the mental health clinicians. So they are, because of we have limited doctors in psychiatry in my country. I think I can count them with my fingers for the entire country.
Oh.
So because of the limited human resource, the government through their partners try to train middle level health workers like the physician assistants, the nurses, into mental health. So they are called mental health clinicians.
Okay.
So these clinicians are assigned at various hospitals. So if we have cases with mental health, with postpartum depression, or even postpartum psychosis, we do at our level, and then refer them to the
Yeah.
mental health clinicians, and they will start a management at their level, and then further to the psychiatrist.
So what are the signs? How do you know when to refer someone? What should I be looking out for to know that I might be going through
Okay.
some form of depression
So
there?
for example, I mean, right after delivery, so during pregnancy, there are a lot of hormonal changes. A lot. You have increase in progesterone, you have estrogen, it's just a whole lot. Even the thyroid gland and prolactin and everything. And then after delivery, you have immediate drop in these hormones. So when the immediate drop in these hormones,
Uh-huh.
I mean, the body tries to cope, and you have different signs. Sometimes they have insomnia, they don't sleep well, they are tired, they're dizzy. Some of them, I mean, they have like, they get to the stage that they kind of withdrawn, and even their baby, they are very irritable. Even the cry of the baby makes them just so
Yeah.
irritated.
Yeah.
So you have these changes. So a woman gave birth today, and the next day you see she's kind of anxious, she's not sleeping. Even she's get irritated just by the cry of her baby. Even seeing her baby makes her mad. I mean, we try to intervene. What are some of the things that will happen? And then maybe couple of days later, maybe a lady delivered. Like for me, I had a sick baby when I gave birth. I mean, 24 hours later, she was okay. After delivery, 24 hours later, I mean, I was just told, baby is not breathing well. I'm like, what? So I just slumped down, and then I'll go to the hospital and just sit on the floor, do nothing.
Yeah.
So I was just there. I mean, and confused, don't sleep. And then you have, they don't eat well, they drop weight. Imagine a pregnant woman gain close to maybe 200-300 pounds, and then in 24-48 hours she just dropped just 10-15 pounds in less than a
Yeah.
week.
Yeah.
So that's a whole lot. They don't eat well, they don't sleep well, they are restless, they're irritable. The babies, they feel the baby is not a part of them. They don't want their baby, they don't even want the baby by them. Sometimes we have to take the babies from them, because if you don't do that, they might harm the baby.
Right.
Yes.
Yeah.
So with that, when we see these things, we try to
Yeah.
counsel them, and then if it's something beyond our control, we involve
Then you involve
the clinician, the mental health clinician. They will start the initial treatment if there's something to relax them, make them sleep, or if it's beyond them, and then they'll call in a psychiatrist.
Yeah. Wow. And do you see that happen? I shouldn't say a lot, but is it frequent?
So I mean, I can't put my hand to numbers
Yeah.
statistically, but we see them a lot. Even right before I came, we had someone, we had to take her from the ward because we didn't notice that early, and she nearly harm her because we have, like, for us, we have the postpartum ward is big. So you
Okay.
have like 12 beds on the ward. So you have like 12 patients in the room at a time. So the bed is just by each other. So because she delivered, for her, she had a baby that passed after, right after delivery. So because she was confused, disturbed, I mean, she was just all over the place, and she nearly harmed,
Another?
yes, her
Oh,
friend's baby. So we had to take her out. So
yeah.
we see this all the time,
Yeah.
but it's, I can't put my hand exactly to
Yeah.
the numbers exactly,
Yeah.
but we see them.
Yeah, no worries. So do they have family support, or the community support?
So what we do at the level of the hospital, I mean, what we do, we once we recognize the signs and symptoms, before we even refer to the clinicians, we try to call, because if you come to the hospital being admitted, we have, the next of kin. We'll call them. This is this, and we try to counsel them and explain
Yeah.
to them. Call the family member. This is it, because with these conditions, they need a lot of support. Some of them might not even need medication. They need family support.
Yeah.
That moral support can
Yeah.
help them to pick up a
A
whole lot.
lot. Yeah.
So we talk to them, explain the signs and symptoms of the family members, and say they need you. I mean, more than ever
Good.
before in their life. So whatever way you can support them, you support them. Do something to make her smile, happy. Just talk to her, lecture. Just do other things that will.
Yeah.
And sometimes some of them come out of it, but some of them, I mean, if care not taken, they even progress into a full blown
Full.
postpartum psychosis. Like,
Oh,
yeah.
wow. Because that was going to be my next question, is like, how long does it last?
So sometimes it lasts up to 2 weeks, but the first 2 weeks after birth, after delivery, but that's the crucial time. If care is not taken, sometimes they will go back to normal. Some will actually progress into. So it starts with the postpartum blues, and then goes to depression, and then goes to psychosis. Yeah.
Okay.
Of them who have babies with deformities. Oh, I mean, we see that all the time. Sometimes they even run away and leave the baby at the hospital.
Yeah. So we have so many variables in place here for a woman, me, right? I have a child, and to piggyback on what we heard earlier, the father might not be in the picture. The baby's getting all the attention, and I'm the one, and I think I went through that a little bit. Like, wait a minute, what about me?
Yes.
Hello, I'm the mother, and everybody's gushing over the baby and forget about you, and so you could feel a certain way.
Yes.
So what advice would you give to a woman like me who's, I'm pregnant? Is there anything you would tell me to be aware of, or what are some tips and things to be, to help me out? So either if I do go into depression, I can come out of it quickly, because I understand it could go for a year. It could go 2 weeks, it could go 6 months, it could go for a year, depending on the many variables that are in place.
So the thing is, I mean, once people are aware, like maybe antenatal, you come to hospital, we discuss everything. Like, what we do for back home, every time the woman come to hospital, we discuss. We talk a lot. We might not go in depth, but we talk a lot, and we allow you to ask questions. For me personally, like, is there anything else you want to talk about? We talked about it. So if she's aware of these things, the common signs and symptoms of depression, and how to get out of it, like, these things happen. Most especially, I mean, with babies, all the attention obviously will go to the baby. But don't worry, it's your child.
Right.
Everything will be okay. And then some of them will even come to the hospital with their spouses. So you also tell them that, after birth, she needs this support. So all the attention should not just go on the baby, because she also needs the support. Because, I mean, during delivery, you lose a lot of blood and everything. So she comes home, she need that support, nutritional support,
Yes.
moral support, and just everything.
Yes.
So she has to be given that support, so that, she doesn't slump down to go into depression. So
Yeah.
all those things have to be talked about.
Absolutely, absolutely. Any other advice or tips you'd give us, black women out there who are just saying, nope, I'm not depressed. Nope, nothing's wrong with me. Because if you haven't noticed, in America, we celebrate Mental Health Awareness Month in the month of May, and so you probably wondering like, why am I harping on this depression thing? Well, it's that time of year that we spend a lot of energy on it because we want to build that awareness for women, for men, for families, that it's real. And in the black community, we find that it's getting better, that we ignore the signs. We think that, oh no, that's softy stuff. That's not for us. Like you said earlier, the myths
Yeah.
in your country in Liberia where they're like,
I
that's
mean,
not
yours
real.
is even better here. Mine, they don't believe anything. I mean,
Anything.
absolutely. I mean, so you see a woman with postpartum depression, you even tell the woman, no, I'm not depressed. Even the relative will even believe you, not
Yeah.
even to talk about the patient. So at
Yeah.
least, for us, I think we have more work to do than you guys
Yeah.
because we also celebrate mental health,
Okay.
yes, as
Good.
well in Liberia.
Good.
So, I mean, the constant talking,
Mm-hmm.
continuous awareness of these things, it will help a whole lot
Mm-hmm.
because, I mean, Africa, we put a lot of attention on. I mean, like sometimes something will happen to someone. Is no, it's witchcraft. It's something else. It's something else.
Right.
Something else. So,
Yeah.
if you don't tell them this is depression, it happens, it's real, these are
Mm-hmm.
the signs and symptoms, and say it all the time, all the time,
Mm-hmm.
people would even end up going mentally ill, like into full-blown psychosis without
Mm-hmm.
knowing these things. So we need to talk more. We
Yeah.
need to continuous awareness will help a whole lot.
Yep.
So at the hospital level, at the community level, even at the churches, we need to say these things because in my
Exactly.
church we have health talk every Sunday. So if it's just 5 minutes,
Good.
yeah, 5 minutes we talk about different illnesses like malaria or
Mm-hmm.
diabetes, not just general health illnesses. So we talked about it. So even if a church member in the church will like want to ask question after church, you can just reach
Mm-hmm.
out to whoever because we're three in the church because I do health talk. There, my colleague who's a lab technician and then a public health specialist in the church.
Mm-hmm.
So we do health talk 5 minutes every Sunday. So that way it helps a whole lot because if I have a church member who don't go to hospital but she hears something about malaria or
Yes.
typhoid or diabetes in the church, okay,
Yeah.
if she has a child or a
Mm-hmm.
relative or a neighbor that's having these symptoms, she's like, oh yeah, I heard in church today they said this, and that could help that person to get help from the hospital.
I love it. I'm gonna have
Yeah.
to be shameless right now. I'm gonna steal that idea. I like it. Health talks. I
Yeah.
think we
So
may
it's like
already.
5 minutes
Yeah,
every
5 minutes. That's
Yes.
all it
Just
takes.
common, I mean, disease conditions, common
Yeah.
signs and symptoms, and what to look for, and then that's all. Then, I mean, if because you don't want to take the whole service time, so just
Right.
5 minutes. So you took
Five
5 minutes,
minutes.
and then after service, if anyone has
Yeah.
other question, they can just reach out to you and ask.
I love it. I love that. That is brilliant. And even for the group, the platform that I'm a part of, Women on a Mission, even just to put a not even 5 minutes, like just little tidbits, like health tip of the day, health tip of the week, just to keep it going and fresh in people's minds that you need to take care of this body that God gave you. You
Thank
need
you.
to be aware of what's happening inside and out, right? It's not just what you see out here, but what else is going on inside.
Because a lot of things we go through, I mean, a lot of things that we just should not go through, we go through them because of lack of
Lack
awareness.
of knowledge,
Yes.
education, lack of resources,
Thank you.
right? Ability to, I don't drive, so I have to rely on, someone else. And so that just limits me sometimes, or whatever it might be. So we want to make sure that people have what they need
Yes,
in
exactly.
time. Absolutely. This has been really great. I am
Yes.
so thankful
Yeah.
for you to be here.
Yes, I'm
We
happy.
could go in like
I
so many
know. I
directions with this,
know.
and we could be here for hours. But I am going to, well, let's see now, put out my invitation to have you on
No
again, and
problem.
maybe it'll be through virtual world, because
No
I don't think I
problem.
can come to Liberia right now. I have to go get all kinds of visas, right? I don't know. But it would be nice if I go to
Yes,
Liberia.
yes.
But yeah, so thank you so much.
Oh, absolutely. Thank you so much for having me. I am so grateful. Thank
Thank
you.
you. All right. This has been great. Next time on Conversations on Purpose. Who's going to be next? We don't know. So stay tuned.
Okay.